Hello everyone. I hope you and your family are well. The COVID-19 pandemic continues to require a fluid response as guidance from the World Health Organization and the Centers for Disease Control evolves. We will continue to make operational adjustments to our agency-wide response as needed. I thank each of you for your continued dedication of completing our mission and your outstanding efforts to mitigate the spread of COVID in our institutions and our communities. I intend to do a weekly video message to update everyone on what we are doing and why. I will discuss hot topics and attempt to dispel any rumors and false information that may be spread either in our facilities or due to misrepresentations of BOP operations in the public. For instance, let me assure you, we have a significant quality of personal protective equipment. Please follow procedures and be responsible in how and when we use it. We are closely monitoring this inventory. I mentioned in my last video, one of the provisions in the CARES Act directs the Department of Health and Human Services to consider BOP a priority for distribution of PPE and COVID-19 test kits. While the supply is still limited, it will assist in diagnostic purposes when a need to test widespread transmission quickly exists. I'm happy to say we've been given access to both test kits and other hard to acquire items such as ventilators and medication, and we're working to incorporate the use of these new supplies into our COVID response. Our contracting staff are making purchases daily to ensure we maintain our inventories. I must recognize Unicor for their ongoing efforts to help out during this crisis. A number of Unicor operations helping with the COVID response is increasing daily. There are currently 10 factories producing cloth face masks. By next week, 9 more will be opened. Some of our factories are producing masks for the federal government, and some others are providing them for us, both staff and inmates. Unicor also has 2 factories making non-surgical gowns, another making emergency blankets, towels, and linens. We have a factory bottling hand sanitizer, and 2 others are producing units of emergency water and milk. Way to go, Unicor. Thank you for the staff and the local institutions for facilitating these efforts. I want to clearly explain why we are now issuing face masks when we weren't before. The BOP has been following distinct guidance put out by the CDC. On April 4th, the CDC amended its guidance regarding the use of face masks and began encouraging all persons to use masks in public. In turn, we amended our response and began issuing masks to all institution staff and fit testing for the use of N95 masks as appropriate. I'm sure you all are aware that more than 35 of our institutions nationwide have been directly affected by COVID-19. Over 299 inmates have confirmed lab results indicating positive tests, and sadly, we've had 9 inmate deaths attributed to COVID-19. In addition, over 125 staff have lab-confirmed positive test results for COVID-19. Recognizing that more than 30% of our federal prisons are now currently affected, we must all keep our brothers and sisters in our thoughts and prayers. There are some locations more significantly impacted. Unfortunately, institutions such as Oakdale, Elkton, Danbury, Lompoc, Butner, Yazoo City, Forest City, and Milan are all hotspots for COVID-19, and they all need all of our support, everything we can provide them. For example, there are approximately 1,300 secondary law enforcement officers in the Bureau, and as this pandemic continues, they will be deployed to assist in locations experiencing staff shortages, the number of which will likely increase in the coming weeks. We've already deployed 45 secondary law enforcement staff from BOP headquarters, regional offices, staff training centers, and the Grand Prairie complex to field locations and are ready to deploy more when needed. Additionally, a BOP Medical Asset Support Team, MAST, has been deployed to Oakdale to assist with clinical, administrative, and technical support within health services. The COVID pandemic is creating unique challenges for some of our facilities, including impacting the healthcare delivery system in the surrounding communities. Therefore, we invited the CDC to provide assistance and expertise to review the BOP's response and strategies with regard to COVID. The CDC accepted our invitation and made a site visit to FCC Forest City and engaged with staff at FCC Oakdale, along with other public health officials, in order to assess ways of reducing transmission and managing inmates in quarantine and isolation. Notably, after the engagement with FCC Oakdale, and the CDC indicated that the BOP was implementing all strategies that they would have recommended. Even though the BOP is applying the guidance provided by the CDC, additional expertise from on-site visits by CDC staff experienced with infectious disease management in a correctional environment is very helpful. You may have also heard the Army Corps of Engineers and the Ohio National Guard were deployed to FCI Elkton. Given the surge in positive cases in Columbiana County, Ohio, and the growing number of quarantine, isolation, and positive cases at FCI Elkton, the Health Commissioner of Columbiana County Health District, working with the warden and his staff, assisted in coordinating these additional medical resources for FCI Elkton. It's perfectly acceptable and the right thing to do for us to accept assistance when needed. The BOP's efforts in responding to COVID depend on our coordination and relationship with our community partners. We entered into an intergovernmental agency agreement with Ohio, and we will pay for all equipment, services, and personnel used during this crisis. 32 medical care providers, including physicians, mid-level providers, medics, phlebotomists, and radiology technicians, will be utilized as an inpatient bridge unit that will provide lab testing, portable x-rays, and inpatient care to inmates on site without taking them into the community, which alleviates pressure on the community hospital's available bed space. We deeply appreciate the assistance from the Army Corps of Engineers and the Ohio National Guard. Directly in response to COVID-19 pandemic, additional authorities granted to the BOP have allowed us to increase home confinement by over 40%. We're continuing to aggressively screen all inmates who have COVID-19 risk factors, as described by the CDC, starting with inmates at Oakdale, Danbury, Elkton, and similarly situated facilities. Case management staff are urgently reviewing all inmates to determine which ones meet the criteria established by the Attorney General. Since Attorney General Barr's March 26 memo instructing us to prioritize home confinement as an appropriate response to the COVID pandemic, the BOP has placed an additional 886 inmates on home confinement. We continue to work with the U.S. Marshals Service to reduce the amount of external inmate movement required. I want to stress that compared to normal times, we have reduced inmate movement by more than 80% by eliminating discretionary movement, but we cannot eliminate movement 100%. There will always be legally mandated reasons we have to move some inmates. I also feel obligated, because of the confusion of people who don't always know or understand the facts, to remind you we are statutorily obligated with the care and custody of all sentenced inmates, as well as pretrial inmates ordered by a judge to be detained. As long as the federal courts continue to remand pretrial inmates to custody and continue to sentence inmates, we are required to process and accept them into the BOP. The Families First Coronavirus Response Act went into effect on April 1st. This act allows up to 80 hours of sick leave for federal employees to use for COVID-19 related absences. The specific qualifying reasons, as well as the time frames to use this leave, will be available on Sallyport. But I hope that this additional leave will ease any concerns with not having sufficient leave that may be needed to comply with quarantines or experience symptoms related to the coronavirus. Once again, I ask each of you to remain calm. This is what we do. On a normal day, we often deal with situations that make most people cringe. But I understand that battling the invisible and unknown can be frightful. I feel just like most of you. But also have faith in our team, and I hope you do as well. Please practice universal precautions. Wash your hands, avoid touching your face, sneeze or cough into your elbow, frequently disinfect areas around you. Use social distancing when possible, and wear a face mask when it is not. Encourage and remind the inmates to do the same. These preventative measures work. While as an agency, the BOP continues to appreciate the support and assistance of the Attorney General, Department of Justice, the CDC, the Public Health Service, and our state and local community partners, it is you, the staff of this agency, that are carrying out our mission in spite of the difficult conditions of this public emergency. Your dedication to keeping your fellow staff, the inmate families, and the general public safe during this evolving global emergency while being law enforcement professionals on the front lines is a true testament to what being a corrections profession is all about. Please do your very best to stay healthy. We will get through this together. Together we are stronger. Together we are making the difference. Thank you.